We'll show you that everything is laid out here, and we'll be setting up and changing, like cleaning the stethoscope if it was used, and putting the stuff back together if it's going to be the same patient. So everything will be in a bag, and including the non-rebreather. And remember, the non-rebreather comes how when it's new?
With the extra valve, with that valve on it? That you have to
Well, it
take
has
off,
two valves, the non-rebreather, right? But how does it come packaged?
As a simple man?
No.
Seal.
It comes in a package with this label that says non-rebreather, rebreather, and simple. So all three masks, so regardless of what your order is for, we won't order a simple because we don't use them in the hospital. Although another simple mask will be out here on the table along with a lot of equipment you won't need. But the partial, we have them separated in the bins, but they don't come separated. So if you need a partial, you're going to use the same packaging. Okay, just want to make sure that you know that. So we'll kind of go over where everything is. I'm not going to do the charting part, but typically I'll give you a clipboard and I'll tell you to turn that charting page over. So you can write your vitals down, you can write whatever to collect yourself. Obviously you can't do that in the hospital. But we'll give you that advantage, and then when you go to charting, you'll have everything on that back page. Okay, does that make sense? All right. Your order will be a slip of paper just inside this chart that you'll take with you, clip to your clipboard. You can't write on it because we're recycling them. We have a certain number, okay? So I'm going to come over here and write down what the order is going to be. Somebody's going to be writing on the screen already. Okay, so I'm going to give, my patient's going to have, what do you think, Audrey? What do you want? Asthma, COPD?
Oh, mine just should be COPD.
Okay, that's good, very good. Okay, COPD, oops, I can't talk right. With pneumonia, I'll make it a little sicker. With pneumonia, I'll just abbreviate it. And so the order is going to be 5 milligrams of albuterol, and it'll all be spelled out even though I'm abbreviating, and 0.5 milligrams of Atrovent Q4. And then you'll be on a 28% Venimask, and then 2 puffs of Asmacort. How often?
12 hours.
Asmacort, spelling right. How often is that ordered?
Q12.
Yeah, which we would write as what? We're not going to do it at 12 midnight. BID. Okay? Now, what other order could I give?
Peak flow.
Besides changing these peak flow. So I won't do the peak flow. I think that's pretty simple. And, well, just for time's sake, we'll just do the one. Okay? All right, so once we give you the okay, then you're going to gather your equipment, get your order, and go. Okay? All right, so I'll start. All right, I'll already get my order. I'm going to show that I'm giving Asmacort, but I'm going to take the placebo. And I'm going to show my meds. I could give a Duoneb with a single dose, and that would be 3.5 mLs. Or if they didn't have Duoneb, I could give, I could give 1 ml of concentrate along with 1 unit dose of ipratropium. Or if they're really poor, I could give 1 unit dose, and that would be 1 plus 2.5, 3.5 mLs. And the last way I'll say is I could give a unit dose of albuterol with a single dose to get my 5 milligrams. That's 3.5, that's 4.5, and add this one. So 4.5, 5.5, 6.5, 7 mLs. Okay? All right, so I'm just going to take the placebo. All right. Mrs. Dennis? Hi, Mrs. Dennis? Hi,
hello.
I'm Sue from Respiratory. Your doctor's ordered some oxygen and a breathing treatment for you. I'm going to wash my hands, and if you could, what you working on? Crossword puzzle. Okay, I love those. All right, so once we get ready to go, if you can put that aside for a little bit, and then we'll get you right back to the crossword, okay?
We're almost done here.
Okay, very, very good.
You don't happen to have a dictionary in your pocket, do you?
No, I don't. My grandma used to use those crossword dictionaries all the time. I thought she was cheating, but now that I'm doing them, I could use one for sure.
If I gave you money, could you stop and get me one? And I think they have them in the gift shop.
You know, that's something that I've got so many patients to get to on so many floors. Certainly, if I had the time, I'd do it for you. But today's a pretty busy day, a lot of sick people.
Well, maybe you could tell somebody else to go down and get it for me.
Well, maybe a visitor or maybe one of the staff here on the floor will be able to do it for you.
Oh,
Certainly wouldn't hurt to ask, would it?
thanks.
I'm going to get some gloves on once I find my size here. I don't think extra large is going to go very, very well for me. What brings you into the hospital?
Well, I really haven't been feeling good.
No.
And I got to the point where, I fell down a couple times, and it was really hard to get up. And I thought, well, maybe I should go to the emergency room.
Sure.
And then they told me I had something about gassy blood.
Uh-huh.
Mm-hmm.
Okay. Well, that's something certainly to talk to your doctor about. May I see your ID? Okay, and what's your name and birth date?
My name is Audrey Dennis, and birthday 5/20/33.
Okay, great. Thank you so much. All right, I'm just figured out what I forgot. Somebody grab a pulse ox for me.
I got it.
And if you're first to videotape, we may have to stop the camera and say, we forgot the pulse ox, or whatever we forgot, right? So Roger, and who else is on her first day?
Me.
Okay.
It's good to get over with first, too. Good idea.
That's right. All right, I'm going to check your oxygen level. Have you ever seen one of these little things?
Not that little.
Yeah, it's pretty
Saw
cool.
big ones, big.
All right, well, I just need a finger. Which one you want to give me? All right, let's try this one. All right, now, one thing you have to know about this is that you have to hold it real still. It won't pick up. So let's just put your arm down in the bed, and let's see if it's going to pick up. It's dying on me, so let me see if I can get it going. There it goes. We'll get your oxygen level. The doctor's ordered some oxygen for you today, and I'll get that set up just as soon as I
Well,
can.
I've never had oxygen before.
No, okay. Well, I don't know what's changed, but certainly something your doctor would know.
Does
Let
that
me,
mean I'm sicker than I was?
well, I really don't know. Let me check your pulse a minute. Your numbers look okay, so you don't need a lot of oxygen.
Okay. What will oxygen do for me?
Just let me get your pulse a minute. Okay. I'll take this off for a little bit. Well, it can help your breathing, certainly get more oxygen in
Well,
your
every
blood.
time I heard about oxygen, people were dying.
Oh,
When
well,
they put some oxygen on.
certainly different amounts of it, so that can certainly change things. I'm going to go
You don't
ahead
think
and
I'm dying, do you?
I really don't have that information, Mrs. Dennis. That's why I keep saying to talk to your doctor. That's your best source. May I listen to your lungs?
Sure.
All right, I'll start with the back. Can you sit up okay?
Yep.
All right, thank you. Okay, now you're going to want to take a deep breath. All right, how about one over here? All right, I'm going to come down here a little bit. Very good, very good. Okay, and lean forward just a little bit. And last one on the back. Okay, very good. Once you set back, and I'll let you kind of catch it. This doesn't look very comfortable.
No, it's not.
Okay, now let's try this. Okay, how's that?
That's better.
Okay,
Thank
good,
you.
good. All right, feel like you can take some more deep breaths as I listen to the front?
Oh, I feel like I'm going to cough, but I
Okay,
I'll
well,
try.
we'll stop if you cough, okay? Are you ready? All right, nice big breath. Okay, very good. All right, over here. Okay, very good job. Okay, all right. Are you okay?
Yeah, I think
Okay, all right. Now listen, I'm going to listen right up under your breast. Okay, and under on this side. And over here, one. Okay, and last place over here under your arm. Okay, thank you so much. I know that's very tiring. I'm going to go ahead and get some oxygen on you. And like I said, it's not a lot of oxygen. So I think that it will just help your breathing a little bit. I think that's how you'll notice it. But that little thing I put on your finger tells us if you're getting it or not. Did you come in through the emergency room?
Yes, because I fell down twice and thought I should go in.
Okay. So maybe it was low in the emergency room, and that's why they ordered it for you. Okay. Yeah, I'm telling you, the print on these things is not getting any better. Okay, I finally found it. Each color is a different level of oxygen. So that's why I got to make sure that I'm giving you the right amount, the amount your doctor ordered. So this oxygen is going to be with a mask. Do you think you'll be okay using that?
Yeah, I don't know. I never had one before.
Okay, well, we'll certainly try it out and see how it's going to work. It's got this mask here, and I'm going to put the strap behind your head. Let me go ahead and connect it, and then I'll get it put on. Well, I got it all tangled up here, so let's see if that's better. Okay. All right, so I'm going to first put it on your face, and then I'll get the strap on. You let me know if I'm hurting you at all or if it's just uncomfortable. These things come a little crooked, okay? And I'll get it above your ears.
I feel like I'm drowning.
Yeah, it's hard at first to get used to, okay? All right, take some deep breaths. Is that good?
Can't open my eyes all the way.
Yeah, I know. It's kind of high up. They say one size fits all, but that's not true, is it? Okay, all right, good. Let me put your oxygen sensor back on. Let me turn it on first. Just to see how that's doing. I'm going to lay your arm down, and remember, it's got to be real still. As soon as I get a reading on that, we'll be good to go, okay? Okay, now remember, it's not going to read. You want to see it? Okay, well, hold it real still, and then you can see it. See that little bar thing going? It's got to pick up your pulse. And from your pulse, it can actually read your oxygen. It doesn't seem to like working this way. Let's lay it down right here, just to make it happy. Have you ever had a breathing treatment before?
Oh, yeah.
Yeah. Okay. Do you take them at home?
Nope.
Oh, well, that's lucky.
I got one of those things that you press on, you know.
Oh, yeah, the inhaler. Do you use that with some frequency?
Well, when I get short of breath,
Uh-huh. Does it help you?
yeah. Usually.
Yeah.
Usually.
Okay, this
Sometimes
is
it
very
doesn't.
good. I will go ahead and take that off. Check it in a little bit. Okay, well, I'm going to go ahead and put this together, and then I'll tell you how to use it. This is like the inhaler. It's just a different way of giving medication. And it,
Is it better?
it's just different. Sometimes when you're not breathing the greatest, it can be a little bit better. The inhaler requires you to take a deeper breath, and this one doesn't.
Well, that's good because I take the deep breath and start to cough.
That's right, yeah. So sometimes this can be a little better for that reason. Okay, so your medicine is in here, and you're going to have to hold this like this. If you turn it, the medicine's going to dump out. Just want to make sure how you're holding it.
Okay.
I'm going to take the mask off when we get started. And you're going to put your mouth around this, and you want to keep it tight. You don't have to grip it with your mouth, but you just don't want the medication to escape.
Okay.
You want to breathe in and out through your mouth, not your nose. And you just breathe normal. Like I said, you don't have to take a deep breath. And you're going to see the mist come in and out as you breathe in and out. And then once it starts to sputter, we'll be done. Okay, do you have any questions?
No, maybe when you get started.
Okay, all right. Let's go ahead and take your mask off. I know you're not sorry to see that go.
How long is that going to take?
Oh, maybe about 8 to 10 minutes. Not very long. All right, so it's a nice mist. It's cool. And just hold it and then put it right in your mouth so we don't waste any, okay? You don't want to waste any. I know you want to get out of here as soon as you can. So now just breathe back and forth. Okay. Now I think you're maybe going through your nose. Try through your mouth and keep your tongue out of the way. That's good, but you want to get your lips around it good. Okay. In and out. Nope. Just nice in and out. Breathe in through the mouthpiece. Let me see it. Let me see the mist go. No, I think you're breathing through your nose, and I don't want to have to put
I
nose
don't
clips.
breathe through my nose.
Oh, well, for this, you've got to get your medicine through this.
Well, I have to think about it.
So let's
then.
try it. Now, otherwise, I'll get you some nose clips, okay? All right, so in and then out. Okay, good. Very good. Okay, one more maybe? Okay, good. All right, good. So you've got it. Very good. Nope, you want to make sure you keep it nice and normal, okay? So at this point, we wouldn't let the treatment run all the way. We would ask you how to monitor the patient, and we're looking for that mid-heart rate range. So if you haven't left the pulse ox on, and it can be uncomfortable, then you're just going to put that on again to get that mid-heart rate. And then tell us how you know when it's done, and that, of course, is the sputter. All right, Mrs. Dennis, I'm going to go ahead. This is done. I'm going to put you back on your oxygen. Okay, and actually I'm not going to put you back on, but we'll assume that that's back on. I'm going to turn it off. Okay, the last thing we need to do is to have you use an inhaler. And
That's what I use at home.
that's right. Well, this one is different. This one actually is going to help you what we call, it's what we call a maintenance drug. It's an inhaled steroid. And when you hear steroids, sometimes you kind of think of the steroids that athletes take. It's a very low dose to keep your lungs kind of on a steady keel so you're not having to use that other inhaler so much. Okay?
Well, that's a good idea.
Uh-huh. So I don't know how you use your inhaler at home, but I'm going to teach you the way that has been recommended by the manufacturer, okay? So one of the things you want to do is take the cap off, make sure there's nothing in there, and take the canister out. There's two things you want to do with that. The first is you want to warm it, especially in the winter when you're carrying your other inhaler in your purse. This one you just use twice a day. So I usually keep it in the bathroom or have the patients keep it somewhere, and I'll tell you why in a minute. So I've warmed it, and now I'm going to shake it because the medication is in there with a propeller.
Nobody ever told me to do that before.
I know, sometimes it's frustrating. You get things they don't tell you how to do it. So now you see that little notch in there. That's where we're going to put it back in. And real careful, we don't want to waste any of your medication. Okay? So when this medication comes out, do you notice sometimes that it hits you right in the back of the throat? And you end up tasting
it's in
it.
my mouth.
That's right.
I got it
Well,
right
I'm
in
going
my
to show you a
mouth.
trick, a new way of doing it, and that is to pull the inhaler away from your mouth 2 fingers distance. So if you put it out like this, and then take it away, open your mouth real big, and as you start to breathe, push down, keep breathing, and hold your breath. Okay? You think you can try that?
Well, you watch me. and see if I
Okay.
do it right.
All right, good. All right. So go ahead.
Do you want me
And
to
let's
warm
start
it
at the
up again?
beginning. Yeah, let's start at the beginning. Okay. Good. Yep, just go back and forth to warm it. Just warm it with the palm of your hand. Okay. And now what? You want to shake it.
Okay.
You want to mix the drug and the propellant. Good, good. Okay, good. That's good. Now go ahead and put it back in the boot. That's what they call that. It's kind of shaped like a boot. See where that
Be
goes?
real
Yeah, just
careful.
real gentle.
Okay.
Okay. So now let's go ahead and put it up. Put your 2 fingers on your right hand. 2 fingers to your lips. Yeah. And then move this right up to this finger right here. Okay. Now move your 2 fingers. Move these 2. Yep. Leave this back up here. Okay.
Wow.
Maybe do that spacing again to get it away from your mouth. Good. Now move these 2 fingers. Move these 2. No, you got to put this back. Okay.
That's hard.
Well, I know. It's something you got to get used to. But if you don't want that taste in your mouth, it's worth learning a new way. So go ahead and move these 2 and leave this one here. Open your mouth wide. Start to take a breath and push on the canister. Okay. Start to take a breath and push. And we'll say that's a push. Keep breathing. In. Close your mouth. In, and hold it.
Didn't go anything. Nothing went in there. Maybe because I'm right-handed.
Okay, let's try that. All right, let's do that. Now we're going to wait maybe about a minute and take another puff. Do you always take 2 puffs with your inhaler?
Yes.
Okay, and this one is no different.
But I put it in my mouth.
Right, and that is another way to do it, but you get that taste when you do that.
You're right.
Mm-hmm. Yeah. So, okay, so put it up there. Good. Okay, move the 2 fingers, mouth open. Big breath in. Push. In. Close your mouth. Hold it. As long as you can. Very good. Okay, good. Good. Okay. All right, now this medication is different than your other inhaler for 2 reasons. 1, you only take it twice a day.
Okay.
2, you have to rinse your mouth and gargle after using it.
Why?
Well, because over time, it can build up in your mouth and really let that normal bacteria, you know how you have good bacteria in your body, and it can actually cause thrush. You know how some babies can get that. But if you rinse your mouth, it doesn't do that. And actually,
Why are you giving me something that's going to make me sick?
because I want to keep you out of the hospital, right? So it's not going to make you sick because you're going to rinse your mouth afterwards. If you put it in the bathroom and use it before you brush your teeth, you don't have to worry about remembering to rinse. You use the dose, brush your teeth, gargle a little water when you're rinsing, and you've already done it without even thinking about it. Okay? All right, so I'm going to go ahead and listen to your lungs again and check your heart rate. And of course, I would do a respiratory rate, but we won't have you do that again. Okay? All right, Mrs. Dennis, we've got your oxygen back on. I'm going to come to give you a treatment in about 4 hours. And what I'd like you to do before that, though, is I want you to see if this medication has loosened anything up, okay? Do you think you could try and give me a cough?
Oh, sure.
All right, here's a tissue. Okay. All right, take a deep breath and cough. Okay, all right, okay. It's kind of hard to cough, isn't it? All right, let me put my hands down here. Now, when you take a deep breath, I want you to push away on my hands. Okay, big deep breath. Big deep breath, now cough. Oh, that is great. Okay, thank you. All right, after this treatment, you should always cough because it's going to loosen things up in your lungs. And like I said, we'll be by about every 4 hours. That other inhaler you won't take until 12 hours from now.
Should I call if you don't come?
Well, you know, we have quite a few people on this floor that'll be getting treatments. So we'll be here. You don't even have to worry about it. Okay? Would you like me to put your bed down a little bit before I
No,
leave?
I'm fine. I'm going to finish my puzzle.
Okay, very good. All right, let me get your tray table up. Is there anything I can get closer for your reach right now?
Well, yeah, I could give me a dictionary.
Right, and we discussed that. I'm really got to go to the patient just 2 doors down. They've been having a lot of trouble breathing today. Okay?
Okay.
All right.
We'll see you again.
Okay, I'll see you later. Thank you. Okay, and at this point we'll say, all right, you're done. How did you do? And so we'll ask you to comment on your performance. We'll ask the patient in the bed to comment, and then the 3 of us will comment, and then we'll turn the camera off, and you'll chart. Okay? Questions? Any? Yes.
The charting for heart rate, like in the SVN and MDI, do we have to stop and chart in the middle?
No, you'll chart your assessment numbers. And you can make up the ones like for post-assessment. Your breath sounds. Now that's a question. That's something I didn't set up. See how I find these things out? After you listen to breath sounds, I will bring you the breath sound tape. And the sound I pick should match what up there on my order?
The disease.
Right, so I could have crackles with pneumonia. I could have bronchi because the pneumonia has exacerbated the COPD. Right, I could have wheezing. Right, so, but if it's asthma, what should I have picked? Wheezing. If it's asthma with pneumonia, I have some choices. So you should be able to anticipate what breath sound that I'm picking, right? What other questions? I didn't finish up, I didn't take my gloves off, I didn't wash my hands, but, we'll do that off camera.
When you're giving the patient, it's called for an MDI, do you allow them to be on oxygen, and can they perform the MDI?
If they have a cannula, yes.
Right.
But we'll have, for the patient in the bed, we'll have the flow turned off.
And they can perform a peak flow as well with their nasal cannula on.
Yes, yeah. Serena.
If they have a nasal cannula on and during the SVN, although the oxygen, anything that's going to the patient, you don't want to not have a flow. So you would put the nasal cannula like under their chin or?
Yes.
Okay. And for right after you were giving instructions and saying, basically it's great to have your medication already in the bathroom and so forth.
Yeah.
Now, did you reassess or put the oxygen back on first?
It didn't matter. Well, I was going to get the oxygen on before my assessment, but I could have done my assessment before the MDI. Would the MDI have changed my assessment?
No.
No.
Something about the cough, too. That can be done before the MDI.
Yes.
That's what I was going to ask.
Yeah, it doesn't matter because the MDI isn't going to affect it. So that's why I said I gave you, I will give you the list of when you do things. But, obviously it can, now in the hospital, you get to, depending on the oxygen, if it's a high amount of oxygen, then you're going to get that on first. But if it's on a low amount of oxygen, you'll give the treatment first, assess while they're doing the treatment, right? You don't have 30 minutes, okay? Other questions?
You said on charting today that we had to chart the reason for the treatment?
Indications will be on that
Does that,
sheet.
so is it the sheet you gave us, or is there a different sheet, different charting sheet?
The sheet I gave you.
Okay.
It has patient name, number, that's off the ID. It's on
Okay,
your
so
order.
indications is on top, then not
Uh-huh.
for each order, okay.
Yeah, and then you write the orders in, and then, yeah, you don't put the indication every time.
Okay.
It's just
All right.
a new patient. And yours will be a new patient. No one else will have charted on it. Anything
You
else?
said the indication is not the disease, so what will we put for this particular patient?
Well, what's the indication for a bronchodilator for COPD?
Probably an exacerbation.
Bronchospasm. Directly what the medication is going to do. Right? Bronchospasm is the problem. I'm giving a bronchodilator. Right? What about the indication for oxygen? Hypoxemia. Simple. So if you will have an oxygen order and a bronchodilator order, so you better have something in there, for both. What else? The patient is going to be more cooperative, but they may need help sitting up. They won't cough well. What else, Audrey?
They might not be as, they might stick in a few things that intentionally will throw.
They don't do it to trick you. They do things they've seen patients do, just what Audrey was doing. Okay? Unless someone's told them to hold the pulse ox quiet, they don't know to do it, right? A lot of different things that they've seen patients do because they know how nervous you are. They did this a year ago, right? So they're not going to give you anything, and they're not going to give you the worst patient they ever had either. Okay? Yes?
What about the talking? Because it seems like patients can get you confused by keeping you talking.
What did I keep doing?
Refer to the doctor.
Kept referring back to the doctor. But see, that's what I mean by practice, right? Because if you're working in the lab with someone who isn't communicating with you, number one, if you don't communicate with the patient, even if they're not communicating, you're going to lose points on communication, right? So you at least have to be communicating with the patient. Doesn't matter if they say a word. They might be unconscious, not in this scenario, right? You've got to be communicating with the patient. If they are communicating, you've got to know what you're doing well enough to talk and chew gum, right? To talk and do what you've got to do. Okay? What else?
For medications, are you looking for all the ways to administer?
2 ways.
Just 2 ways.
If you fumble
Okay.
on one, you get another. If you fumble on 2, you get another. We don't go past 3 ways. So that would be a fail for that point, and that's a critical error. So it would be more points off. Anything else? It was 28%.
That's 2 liters.
Mm-hmm.
What percent do you want us to put it on right away?
Anything over 35, 40, probably anything over 40. So partial, 50% Benny, partial non-rebreather, 5-liter cannula, 6-liter cannula.
If they ask you about medications and you are giving a steroid, don't say steroid because they've heard bad things about
Right.
steroids.
So when I said it, I immediately had to say what? Not the kind the athletes take. Right.
If you don't mess up on the medication, are you still going to ask us during what else combination?
Just when you stand right here before you've gone in the patient room, I'm going to ask you for the ways and then remind you to take the placebo. So 2 ways if you knew them both, 3 ways if you didn't. Okay, what else? Yes. Nope, that was just a flashing hand.
How many types of MDIs are you going to have? Is this going to be 1 or 2?
I can only have a steroid, right?
Okay.
So all I have is Flovent and Asmacort. Because you're giving albuterol, you're not going to be giving albuterol again, right? In an MDI.
For the asthma court, you just want us to show you that we know which one it is and then
That's
grab
right.
the placebo?
Anything else? Okay. When you come to your lab session, I'll have handouts for you, 2 more handouts to show you how you're graded and step by step of the procedure. All right.